Okay, you are live.
May I have a motion to accept the minutes from the last meeting?
So moved.
Is there a second?
Second.
It's been moved and seconded. All in favor?
Aye.
Aye.
Aye. Okay, we have two items. We'll start with the item number 6, offered by Mayor Horgan. Ordinance authorizing the mayor or his designee to accept and expend funding from Goodyear Tire and Rubber Company, Better Future Grant, and declaring an emergency.
Good afternoon, members of the committee. I'm Don Rice. I'm the Director of Human Resources. My office administers the Goodyear Grant. This is a grant that we have received for the past 5 years that basically underwrites probably 45 to 50% of the costs associated with the Mayor's Youth Leadership Council. They've done a lot of great work in the past year as it relates to Hugs and Gloves and our financial literacy sessions that over 1,000 students attended and participated in. And the committee does great work, and this grant will help further those objectives.
Thank you very much, Mr. Rice. Are there any questions, comments? Sarah, I can't see any hands. Can you tell me if any hands are raised?
I do not see any at this time, but I apologize. I'm scrolling between a few screens here. So if I missed you, if you could use the raised hand feature. I don't see any.
Thank you very much. What is your pleasure, Mr. Rice?
Suspension of the rules, please.
Suspension of the rules, okay. May I have a motion to accept this ordinance with suspension of rules, please?
Motion to suspend the rules.
Is there a second?
Second.
It's been moved and seconded. All in favor?
Aye.
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 This ordinance passes. The next item I have, if I can get to my screen real quick. is a
I'd
piece
also
that
like
came-
to make a note that Councilwoman Baylor has joined the meeting.
Okay, thank you very much. The next item is, okay. I think I got it, Sarah, I think. No, I don't.
Would you like me to read it in, Madam Chair?
Yeah, I just had it a minute ago. Okay. Hold on just a minute.
Okay.
That's why I burn down trees, because I like to have. Okay, I have it now. Thank you very much for offering. This is an ordinance offered by Mayor Horgan and President Summerville. This ordinance limiting the number of, let's see if I can stretch it out a little bit and read it. Limiting the number of attendees at private gatherings and requiring facial coverings be worn during private gatherings to limit the spread of COVID-19. Establishing means of enforcement and imposing a penalty for violation thereof, and declaring an emergency. I think there's, I know I talked to Mrs. Scott. I know she's going to be present. Is she on the
Yeah,
call?
I'll take the lead on this. Thank you, Madam Chair. First of all, I want to thank Dr. Hart, Dr. Devaney, President Wakolka, President Grace, thank you. And Donna Scott, head of our Summit County Health Department. From the very beginning of this pandemic, I know we've always talked about following data and following science and the best recommendations from our health professionals. And I've said this before too, that we are absolutely blessed in this region to have the health systems that we have operate here, how well that they have operated over the last 8 months and really pivoting very quickly into being able to address these. And we've all seen data from across the country go up and down about who's experiencing spikes and what people are doing to try to control that. Well, obviously, over the last 6 to 8 weeks, you've seen a significant spike, not only in Ohio, but across the country in COVID-related hospitalization, COVID-related testing, people that are coming down with COVID. And we've seen that here in Ohio. We've seen it in the community. You can all look at the numbers, and I'll let Donna speak to those in specific. But as I listen to the hospital systems and our public health, we have tried from the very beginning of advising people to really do the best thing and try to limit the number of people that you're around, wearing a mask, stay 6 feet, wash your hands, all of those safe distancing, protection things that we can try and do. And as I've seen over the last week, at least 4 states, maybe 5, are at a critical capacity when it comes to capacity, when it comes to their hospital systems, and they start to talk about things like rationing care. And now those are scary words to the medical and public health professionals about rationing care and what they can do. And so actually about midweek, and we had talked about cities across the state doing some things, maybe some things different, but what can we do over the next 30 days to really get a handle on this, but not necessarily go to, because quite frankly, as we've talked to the governor's office and what they may or may not do, quite frankly, I think their response has been a little bit of tepid, maybe in the last month or so, to try to get, kind of a handle on this. But we are not seeing the spread, and I'll let the professionals talk to this about what they say. We're not seeing the spread necessarily in restaurants and in that business activity, because quite frankly, I have seen mask and mask compliance up significantly in our area over the last 8 months. If you would have told me 9 months ago that people would be wearing a mask and they would be doing it, maybe not willingly, but they would do it, I see them out in retail places. But where that spread is happening, and there are those social gatherings in people's homes. And so to get a handle on that, this is that proposed piece of legislation to give us the next 30 days. It's almost, you can take it right out of, the Our Fathers, that you want to give us this day, give us the next 30 days to help save some lives. And I'll let the doctors and Grace and Donna talk about where they see the capacity of that system, but this is about saving lives. And this is about limiting those social gatherings. And if this particular ordinance puts you out that much, and it's going to change your daily behavior that much, maybe you're not doing enough to be able to help stop that spread. And I'm not saying that people aren't. I think people are tired, and I think they are weary. But we need to be able to get through this next 30 days to not overwhelm these hospitals so they have to do things like ration care. So I will turn it over to Dr. Devaney. That is, I appreciate you listening to the ordinance. I appreciate the committee, taking the time to be able to, this is a radical step, but we need to be able to get a handle on this to specifically not overwhelm these hospitals so they can provide that critical care for people that need it. Dr. Devaney.
Great. Thank you, Mayor Horgan, and thank you, Council, for letting us speak today. I'll keep it short and sweet. So about 3 weeks ago, we averaged about 20 COVID patients in the hospital, both at the Barberton and City campus. As of 10 minutes ago, we have 88 people in the hospital right now with COVID. We are averaging about 15 to 20 new admissions on a daily basis. We had 4 people this weekend on heart-lung machines. These are people who were transferred from other hospitals to Summa because their breathing had gotten so bad and their lungs were so damaged that we needed to give them a rest. Our ICUs are about 90% filled. We have enough of equipment. Last time we were having issues with that. But what we're starting to see is we're getting to the capacity where we're only really able to take care of people from the community that are coming in through our emergency rooms or one of our physician practices. The more concerning thing is the positivity rate. So we used to, if you have 100 people got tested for the virus, maybe 4 or 5% of them were positive. We're over 20% now in our community. And at our urgent care centers where a doctor order is given, we're now over 50% of the people walking in that are being tested are positive. So what we're seeing is when you talk to all these folks, typically where they've been exposed, it's a family member that they learn about 2 or 3 days later. It may be somebody that they were in the backyard with and they didn't think things were going to be an issue. But we're starting to see it's really the congregation of people coming together. We have not canceled any surgeries to date, but we are on the verge of that all weekend. We kept watching our capacity of our staff. And the big issue now is finding enough people to work to take care of all these patients, because this is also a very busy time of year. Traditionally, we're already at probably 85% capacity, but now we're well over 100%. We've opened 3 extra units at the Akron City campus and one at the Barberton campus. And we're on the verge of looking at opening a 5th unit at the Barberton campus if we can find enough people to work. The predictions now with the current number of positive cases is that we will see a doubling of the number of patients in the hospital over the next 2 weeks. And potentially this could go into January if we don't start to see some really tough interventions around exposing each other. So I will stop there, Mayor Horgan, and kick it over to Brian.
Thanks, Cliff, and thank you, Mr. Mayor and City Council. I'm going to echo what Dr. Devaney said with some equally sobering information. At our single campus today, we have 61 patients. About a month ago, that was about 17. 16 of those patients are in the ICU. That's the second most in the entire Cleveland Clinic Health System behind just the main campus itself, admitting roughly 10 a day. And I am happy to say that many of those patients ultimately get better and go home, but they're coming in faster than we're able to discharge them, and about 1 a day are dying. We are testing about 350 individuals at our 2 testing centers in the community. That number has gone up. Our rate of positivity on symptomatic patients is, as Cliff also echoed, about 25%. We're working with the Akron Regional Hospital Association, obviously with SUMA, Cleveland Clinic Health System, to share practices, look at resource utilization and allocation. But this is getting near the edge of what we're capable of doing. We have opened a second full COVID unit last week, and it's full. We're looking at opening our 3rd imminently. And again, the concern is staffing. We have over 50 of our caregivers just at Cleveland Clinic Akron in general that are out sick with positive COVID tests. What we've seen, and all of you have seen in in the state of Ohio, is roughly a doubling of number of cases every 2 to 2.5 weeks. Small family gatherings, as Cliff said, is where we are hearing from patients and frankly from others that this is being spread. And that's what this virus does. It infects and it spreads. Throughout really all of Northeast Ohio, we're hearing similar things from other hospitals. Our world's on fire and we are near the edge. Mr. Mayor, I'll turn it back over to you.
Yeah, I'll turn it back over. Grace, can you say a few words about the role of children?
Well, fortunately, the coronavirus doesn't seem to have the same hospitalization rate in kids as it does in adults. So right now, our hospitalization rate has been steady at about 2. So that is really good. But we do stand by to help our adult partners take care of patients who are 35 and less. So we've got a unit that we can open. We've got ICU beds and we have staff. Now, we do have about 100 staff members who are out either because they are sick or they are under quarantine. And for the same reasons that both Brian and Cliff had mentioned, it's that they have community-acquired disease from these small social gatherings of people that they don't think are going to bring them the infection, their friends or their family. So we have been working with all the Akron Regional Hospital Association folks all the way through Mansfield, Youngstown, and the public health departments have been on our calls with the regional CEOs to try and manage access. We have a developed algorithm for admissions and trying to get patients access and really to improve care. And we are starting to look at vaccines. But we are very concerned about the Thanksgiving holiday coming up. We are encouraging people to stay home, wear a mask, socially distance, and only have meals or gatherings with your family members who live in your home. I do want to give a shout out to all of our healthcare providers in the region, whether you're EMS, you're a nurse, you're a doctor, or you're working on the front line at any place doing check-ins, because they are really the true heroes right now. And it's our goal to keep those people safe so that when you or your family member or our families in the community need a bed and need care, that we're going to be here to help you.
Thanks, Grace. Grace makes a very important point. I know Brian and Cliff did too, just about the number of people and the capacity. You can't exclude our public safety forces, and they're not immune to catching this. And obviously we all had to develop protocols about how we treat that, then hopefully get them back into service at some point. And those are causing real strains on resources. And I think at the beginning of this, the hospital associations all had their plans for pandemics together. But at a particular point, we all have to think, what's their capacity to be able to do that. And so Donna, if you could share.
Can you guys hear
You're
me?
on mute, Donna.
I am. I'm
Now we
mute.
can. You're not.
No.
Okay, great. Am I on? Okay, good. Yeah, I'd be glad. I think, Danny, you cut out for a minute, but you were asking me to share a few slides.
Yes, if that's where we're going.
Okay, all right.
Go ahead.
You can go to the next slide, please. What we wanted to do today was talk to you about what we're seeing as far as case rate goes in Summit County. We are seeing this consistent uptick. As you can see, it almost is straight up in the air now, the curve. We were able for some months to be able to start to beat it back. Now, this is just September, so don't mistake this to think this is the summer. It was even lower in the summer. We have seen this rate just exponentially increase. And at each of these bumps, and I can tell you the surge in cases we're having right now is related to many of the Halloween gatherings in people's houses that we have been told about when we do contact tracing and we call individuals. You can go to the next slide, please. If you look at the public health data here from the occupancy bed met, where we're inching up for all ICU patients, as well as those that are COVID in the dark blue. Again, we're starting to see that increase in COVID patients coming into the hospital, needing more intensive care and needing to stay. You can go to the next slide, please. So let me talk to you a minute about extensive and uncontrolled community spread. What has happened with this virus is we have slowly tried to get back to what we perceive as more of what we would call a normal life. We went back to school. Some children everybody's on a different model. Some are doing 2 days, some are doing 5 days, some are all remote. I can tell you, when that happened, we started to increase our risk levels. And then what happened when kids were back in school, families started to feel as though they could have all of the school activities that went with school. So we started to have the sleepovers, the let's play video games after, let's do a pickup game. I'm going to have 6 of my closest friends from my children and their families over, and we're going to do a little celebration. What is happening is we're getting people that know each other well, including your other extended family members, and you're inviting them into your bubble. You may know them well, and you may be related to them, but they are not in your bubble. Unless they sleep in your bed in your house every night, they're not in your bubble. But we started to let our guard down. And then so as a result of that, what we have started to see is exponential case climb. We have weekly hospitalization rates are increasing, emergency room visits are up, and the deaths from COVID-19 are increasing statewide. And when you get a lot of community spread, you also then see that mirrored in congregate living settings. So not only do we have wide uncontrolled spread in the community, you then start to see it, as we are now knowing, in congregate living. Because if it's in the community, the people who work in those facilities live in the community and they bring it back into those facilities. Now you add another layer on this and we're in flu season. Flu season this year, I'm hoping that we're all masked and staying away from each other, that it will not be nearly what we have seen in the past. However, it's difficult to differentiate between flu and COVID, the common cold, or anything else. And so what you end up with is a lot of people sick saying, oh, I just have a cold. I cannot tell you that I think I talked to 20 people this week doing initial investigations who told me, oh, I just thought it was a cold. So I went to my family's quote unquote birthday party, sat out at an igloo, at a restaurant, any number of things. And now everybody's positive because they thought they had a cold. We also know that the Regional Hospital Association has reactivated those plans for mass casualty, expecting that we will have more individuals that will be passing away from COVID-19. Could you go to the next slide, please? This is needed. The public health, why this is needed. We have to start to convince people that they have to stay away from each other. We have done everything that I can think of and everybody else across the country has thought of to try to do this. And I know that some of you are thinking is like, well, a Board of Health can just pass a stay at home. We could pass. This is the problem. In revised code, we do not have the power that municipalities have. A municipality is well equipped legally to be able to make rules and regulations for their areas, their absolute zoned jurisdictional areas. They're allowed. We as a health district in revised code, the only thing we could do is give $100 fine. This will allow us to have real-time enforcement. This will allow us to work with folks. And this is just like T21. We had to go city by city until the state passed a larger, more encompassing state law. So this is where we will get the real benefit, is by doing this city by city. And as the mayor indicated, it's time limited. It's for 30 days. We have to do this because what will happen again, and this is the last thing I think any of us want, is a shutdown of small businesses again. Because let me tell you, the number of individuals that do not have food, that do not have gasoline for their cars, who do not have ways to take care of their children, who will then decide about doing all sorts of things to have any kind of money so that they can feed their kids. We can't let that happen again. All we're asking is to try to restrict the behaviors in someone's home as for 30 days and see if we can get to a better place right now. We must focus on the spread, where community spread is happening. It's not in the classroom. It's in everything tied to the classroom. It's not necessarily if you go sit in a restaurant and abide by the rules and eat. It's everything that happens afterwards. Can I have the next slide, please? And I think I can turn this over now to James.
Thank you, Donna. So as everybody has said before, we just want to be really crystal clear about what is and what is not causing the fall surge. This is, I'm sure, becoming a chorus now, but it's private social gatherings. It's what we are doing in our own personal time with our friends and family. That is what is driving this. We have a very, very, very small number of non-compliant businesses. I can count them on one hand. We know who they are. We're working with them. We're doing everything within our power to try and solve those situations. But again, the state has orders out on those. And so we have to work within those orders, and we're doing so. And then to the point that Donna just made, it's the stuff that's happening outside of the classroom. So it's not the business community that is creating this fall surge. In fact, there are so many hundreds of small, medium-sized and large businesses and workplaces that are doing everything we've asked them to do, and they're doing it extremely well. Our classrooms, those within our community that have reopened, are doing extraordinarily well. The outdoor activities where we're able to get a mask on and socially distance within 6 feet, we're not seeing those causing grief. It's everything we're doing when we're letting our guard down with each other, and that happens unfortunately in our own private settings. And that is what is the hardest, obviously, to get at, and what we're trying to get at with this ordinance. So I'm going to turn it over to my colleague, Ellen, who's going to take you through the finer points of the ordinance. Ellen?
Thank you, James. And thank you certainly to all of our hospital CEOs and Commissioner Skoda for walking us through the concern and the issue. And now I'd like to pivot to what we're proposing we do to kind of curb the spread. So the private gathering ordinance that's before your committee today would prohibit large private gatherings. And a large private gathering is defined as one that has more than 6 guests. So that means however large your household is, you can have 6 additional people come to a gathering. So if I have a household of 5 people, I can have 6 guests, which would be a total of 11. If I have a household of 2 people, just me and my spouse, I can have 6 guests, which would mean the total gathering could be 8. So the key here is the number of people coming from the outside, bringing in, their bubble into your bubble. So it's not the total size of the gathering, but it's the number of visitors that you have coming to your home that's important here. And again, non-residents are anyone who is not a permanent resident of your household. So that would mean even if you have children or parents or other close family members who do not reside in your home, those people are considered visitors because, again, as Donna mentioned, those people are not actually part of your bubble. And then for the small private gatherings that can continue, we're going to be requiring masks be worn whenever those visitors are present. So again, if you're sharing a gathering, you need to be wearing those masks. If you're not actively eating or, drinking, masks need to be worn at all times when a non-resident is present, either in the same room as you or within 6 feet. Another exception is if you are outside and you are able to maintain that 6 feet of social distance, masks do not need to be worn. You can go to the next slide. So we want to be really clear about what's not covered by this ordinance. This is just meant to cover what is not already covered by Ohio Department of Health orders. So this doesn't apply to religious ceremonies, restaurants and bars, our schools. All the things that James mentioned are already very heavily regulated and doing a very good job of complying with the restrictions that are in place. So this is really just for the gap that we need to fill, which is what's happening in our own private residences. You can go to the next one. Okay, so of course, everyone's very interested in how we're going to be enforcing this order. The potential fine is $250, and that would be for any homeowner or tenant who is found to be in violation of this restriction. APD is not going to be patrolling, looking for people who are offending this ordinance. This is going to be complaint driven, and then enforcement is going to really be focused on education and voluntary compliance first. So just like with the face covering ordinance, really all we care about is that people do the right thing and aren't holding these large gatherings. So we're certainly not seeking to punish, but that fine is in place for people who refuse to comply or who are egregiously repeatedly offending this ordinance. And the Akron Police Department and Public Health will coordinate and collaborate together on enforcement. As Donna said, the health department doesn't have sanitarians working 24 hours a day, but the Akron Police Department obviously is able to provide that service. So they would be basically collecting data, developing police reports, and then providing that to Summit County Public Health. And they would do the enforcement and the issuance of penalties. So we have information there that can be provided to the public about where they should be making complaints if there is a house party or a large gathering that they feel the need to report. So again, I think this has already been mentioned, but the proposal in the ordinance is that this restriction would last just for 30 days, which would last until December 16th of this 2020. And then at that time, the proposal would be to reconvene and have council look at the current public health conditions and whether or not this restriction was still warranted or whether it could be loosened or lifted altogether. Thank you. I think Chairwoman Amobian, at this time, I think the participants would be happy to answer questions if you'd like to.
Okay.
Take any from members of the committee.
I think you answered one of my questions, that at the end of 30 days, it would be reevaluated to see if it needs to continue.
Correct.
And
we're
we're strictly talking about.
We're hoping that we can get that under control.
Sure.
We
And we're
certainly
strictly
looked at-
talking about private. Go ahead.
No, I'm sorry.
Go
Go
ahead.
ahead, Madam Chairwoman. It's
Dan.
my fault. We certainly are
We're
looking at
strictly
this health
talking
data.
about
almost-
private residences.
Correct, Madam Chairwoman. So essentially all other commercial and business activity is already covered by a health order from the Ohio Department of Health. And so we're just covering what's not covered by that, which would be, again, what we're doing in our own private residences.
And I see where you talk about the collaboration between the Summit County Health Department and I think I saw Akron, was it Akron Police? If something is in progress, I can understand someone to go in there and see it for themselves. But if it's happened already and you get a complaint, how do you determine enforcing that?
So that's essentially more for data collection and just for public health to be aware of where there are concerns and where there may be some repeated large gathering activity occurring. But again, in order for us to issue penalties, where someone will have to be observing it, either an Akron police officer or a sanitarian in real time in order for those penalties to be issued. So we're certainly not encouraging people to call about events that have happened in the past, but we expect those to come, and public health will gather that information and keep that data, again, just as something to be aware of and something to be looking at.
And Ellen, could I add that if we did get that address, the benefit of that is you can then mail some educational materials and the ordinance to folks and educate them on what's expected, the behavior that's expected, and so that you do really get an opportunity to educate.
Okay. Are there other questions from other members? Are there questions from any city council members?
I see that Councilman Lombardo has his hand raised, as well as Councilman Fusco and Councilwoman Samples.
Okay, let's go in that order, please. Thank you.
Thank you, Madam Chairwoman. I guess my question is, how would you differentiate between like a restaurant having, a gathering of, people to eat versus, this household having, a gathering, which would be, limited to 6. So how would you, I guess, answer to, the people that are saying like restaurants are allowed to have all these people?
They're already under Dine Safe Ohio ordinance.
They're regulated, Councilman. So that would be the answer, is that what we're trying to do right now is the exact same thing that the state has already done with restaurants. They've set the regulations for how to do it safely.
Okay.
Did you say Ms. Samples? Who did you say next, Sarah?
Yes, next was Councilman Fusco, and then Councilwoman Samples, Councilman Neal, and Councilman Kamer also have their hands raised.
Okay, please, if you heard your name, please respond in that order. I can't see the hands raised. Thank you very much.
Thank you, Mr. Mobian. I guess don't mind the city of Akron doing our fair share, as we should. But I know these hospitals are regional. Obviously, the health department, you have been fighting this fight for some time now, along with the hospitals, our healthcare providers, and the city of Akron and all. And again, I mean, doing our fair share, but COVID is not aware of boundaries, and this needs to be addressed on a regional basis. It needs to be addressed on a statewide basis. And I know everyone is concerned about this. The governor, obviously, but what is going to happen with the county? Is the county going to be addressing this? Is this going to be like the T21 where, start in Akron and then try to expand out from there? What is going to be the regional approach, I guess, is what I'm asking, because we can do all we can here locally and do our fair share, absolutely, without question. But what is going to be the approach in terms of, and I understand the intent behind this, and it makes all the sense in the world, go to where the problems are existing for now. But what's going to be that regional approach, I guess, that's, I think, where we should focus a lot of attention. And that question would go to anyone.
Well, to tell you the truth, none of us are elected outside of the city. And if they want to approach it in a different way, obviously there's different cities and different townships and villages that they can approach it that way. But I'm specifically concerned about, the health and residents of the city of Akron and trying to limit the spread on there. I mean, I understand about the regional approach, and I think that's the way the hospitals and Summit County Public Health does that. But if we can scare enough people, quite frankly, of not doing these things over the next 30 days, I think that's a significant impact. And if Cuyahoga Falls or Talmadge or Richfield or Copley Township, if they want to institute those things, obviously there's different things that Donna has authority over when it comes to the unincorporated villages. It just, quite frankly, where the situation is now and where those numbers have doubled, over the last 2 weeks, the numbers have doubled. That wasn't necessarily the time to build a coalition around the county to do that right now. So they certainly can do what they'd like to be able to do it. And COVID may spread from one city to another. But quite frankly, those private gatherings in the city of Akron, that's my primary focus in being able to stop that spread so those hospitals don't get overwhelmed.
And Jeff, I would like to echo the same, that we would certainly encourage like T21 for all municipalities to start to push ahead. Akron does have the largest percentage. It's the largest city. So starting there makes sense. You guys did great work with T21 starting, because I think I have told anyone who will listen to me that when we looked at our vaping rates, Akron was the lowest. And it's because you started, I think, the soonest on trying to get it down. And so we had great numbers out of Akron, and that's something you should be very proud of. And so we thought, going to the largest city again made the most sense, and we will continue to offer it and to work with the other municipalities as well. But you're right, we need a regional, we need a state, we need a federal approach.
Thank you. I think that's my sense of frustration. We've not seen the kind of leadership I think early on we did from the statewide level, but now with the numbers, I think we're all aghast. Every day you see the numbers doubling and so on and so forth. And I think that's the sense of frustration we have here. It does need to be regional. Thank you all for your comments. Thank you.
Thank you. So this
Samples.
question is either for Dr. Devaney or Donna. Can you confirm our number of COVID cases here in the state of Ohio in the last 24 hours? Because I think it said a little over 7,000. Is that correct?
Yeah, it was just short of 7,300. And it's probably light because a lot of people don't get tested on the weekends. So expect it to be high tomorrow. And Brian, I don't know if you.
Yep. Yeah. Either it's tough to get tested or the results are not run as promptly on the weekend. So I would expect it would not surprise me if we had substantially bigger numbers. We've had between 7,000 and 8,000 ish for the last 5 days or so.
Yeah, and this happened last weekend where it went from 6,000 down to 5, and then it popped back up. So we'll see it go up.
What's the average age range? Now that we're talking about these gatherings, what's the age range that seems to be the biggest uptick?
I don't know the positive rate, Donna, but I know the hospitalized, I think our average age is 51 now.
Similar here. Median age is in the early 50s.
Young.
You're on mute. I was trying to, what did you say, Donna?
You're on mute.
I'm sorry. The average age for us in the community is about 40 now, 40, 41.
Okay. Well, for me, I'm very supportive of this. I think the fact that you're saying that it's only for 30 days, that 30 days can make a big difference here in our city. I think we have to take care of home. It's what we need to do. We can't wait for the governor to do it. Dr. Acton is no longer there. I think we need to do what we need to do here at home so we can lessen the curve here. 30 days, it's not 30 weeks, this is not 30 years, it's 30 days. And I just think it's time for us to intervene. I don't think this is radical at all. I think we need to do something just to know and have family who work in the medical field. I know that they're strained because you have employees who are getting sick because of this, and now the staff is strained because of it. And the more people that we have that come into the hospital, now we have even a bigger problem. And because of COVID, if you have a loved one in the hospital, you can't even really go and see them right now all over again. Not to pull on heartstrings with anyone, but it took us 4 days to see my dad because we had to wait for a COVID test. and he was negative, but we couldn't go in the hospital for 4 days waiting on a COVID test. And this was in a total different network. By the time we got to see him, he was on a ventilator, and we never got to talk to him again because of COVID. So for me, absolutely supported, and I thank you guys.
Mr. Neal, I think, is that correct, Sarah?
Yes, we had Mr. Neal, Mr. Freeman, Mr. Kamer, and Mr. Malik all have their hands raised.
Okay, in that order, please.
Okay. Thank you, Madam Chair. I understand why we want to bring about something to try to control this. I mean, personally, like Councilwoman Mosley Samples, I mean, I have a family member that's presently in the hospital with COVID. He's been there for 4 weeks. Family, we were planning to see, I've got a new nephew who I haven't seen yet. We were planning to get together for Thanksgiving, but we chose not to get together because my mother's 80 and we have elders in the family, so we chose not to get together, but we chose that. My concern is that we're intruding into people's private space. I'm sure there are families who have not seen each other who are planning to get together. I just don't, my concern is, how do we enforce something like this? I think a campaign to educate folks would be the first place to start about in-home private gatherings. My concern is I'm just intruding in people's homes. I'm up here on North Hill. A lot of big families in the immigrant population up this way. How do you monitor that? And we're right on the, like I said, my family, we chose not to get together, but it was our choice. The greatest gift we have here is the freedom of choice. I'm sure there are families who are planning to get together. I could tell you the precautions that we were going to take. Every member was going to get a COVID test before we got together. Many of us were driving. What stopped that, though, is that we had some family members that couldn't get there. They had to fly, and that was what made our risk too great. And so we chose, again, I want to say we chose not to get together. So I understand. I have great respect for those in the healthcare industry. And like I said, I have a family member that is dealing with this right now. And I've got a nephew who I haven't seen, who I want to see desperately. But our family made those choices on how we're going to conduct ourselves in our private space. And I just think we need to start with an education campaign first, because as Councilman Fusco mentioned, we do this and most people that work in Akron don't live in Akron. People go and they're going to have to do what they want to do in other communities and come back to work and do whatever. This is just, we have to educate people and get people to exercise best practice. But once we start intruding on people's private space, their home, their castle, their domain, I'd like for us to hold off on that, pump the brakes on that, and try other things first. That's just my personal opinion. Thank you.
If I can chime in a couple of seconds. First, we've had an education campaign going on for about 9 months, or about as long as the pandemic is going on. And I quite frankly, we've used every tool I think we could available to make sure that people do make those choices. And I applaud you and your family for making, I think, that's the right thing to do. But you know what? A lot of people are making the wrong choice, and it's having a significant impact in the capacity to be able to care for others. And I get your privacy arguments. I do. It's not necessarily, something that I would have necessarily thought of and saying this is what we need to do. But we need the next 30 days. We need the next 30 days on these hospitals so they don't get overwhelmed. And so while I can understand about the concerns about privacy, I also think the greater health and safety of people not making that choice in the right way is a little more important in that sense. And I think Donna or James had something too.
Hey,
Yeah, I just wanted
can
to add that that there's a big difference here, and I just wanted to make a big distinction. We use the word choice and freedoms a lot when we've been talking about the response to COVID-19. What we don't talk about are the impacts that our choices and freedom have on others that are trying to make choices for themselves and their families. So we may make our choices, but the problem is that when dealing with a communicable disease, your choice impacts my freedom. So as people make the wrong choices, as people continue to gather socially, as people continue to completely ignore the restrictions and the guidance that have been given, that's not just their choice to impact just them, it impacts all of us. And I think that is a huge difference here between anything that we've faced collectively, at least in our lifetime. And the other thing I would say is that many of us might say the same thing about seatbelt laws. We all know people who don't wear seatbelts. We don't always catch everybody. It's not the first thing we enforce every time we pull someone over. And some people feel their car is a sacred place. But we have seatbelt laws because it makes all of us safer. And again, the real issue with saying, well, everyone just has to make their own choices is that people won't make the choice that we need them to make. And by not making that choice, the impact doesn't stay with them and their family. It extends to all of us who then have to, unfortunately, take the consequences. Donna.
Yeah, I just wanted to add, and I think Cliff wanted to add a comment. Russ, I wanted to first thank you for not having that get together, because I can tell you I do many calls to families with initial interviews, and there are very, very sick older adults because the family just thought they were getting together for a casual dinner. And it ended up impacting a whole lot more folks than just the people who decided to host. I agree with James' comments that this is going to overwhelm our hospital systems, and we never want our hospital systems to get to a point where they have to choose who gets care for what and who doesn't. And I think it would shock a lot of people if they knew that those plans are in place, that if you can't care for everybody, who really does get to get care and who doesn't. And so I think it's not just the impact on your choice, it will cause a lot of other death and disability for the whole county if we don't do things differently. Dr. Devaney?
Yeah, the only thing I was going to reiterate is I think people still think this is like the flu oftentimes, that they're sick for a couple of days or they're in the hospital, then they get home. A third of people who contract this will continue to have problems for the rest of their life. And we know cardiac problems, liver, kidney, all kinds of other problems. And so, you know, I think that's part of this that probably we haven't done a good job on educating people, is that obviously those who are compromised are the highest risk for dying. But the fact that many of our folks will continue to have problems. People are admitted to the hospital once with COVID will be back in the hospital again. 10% of those people will be back in the hospital within 30 days. So this is going to be a chronic burden on this community for years to come.
Mr. Freeman or Kamer, I think.
Yes, I believe Mr. Freeman was next on the list.
Thank you. Hey, Donna, I want to say first off, thank you. We've been touched here at our house, and we quite honestly were very, very impressed by the communication from your department and the way you've tracked everything. So thank you for that. I do have a question as far as, and I know it's something everyone's considered. Have we considered, constitutionality? Where does this fall? And I understand everything we're saying, and I've just watched a member of my family get out of bed for the first time in 13 days. And this is not an old person, this is a younger person. But my question is, legally, law, constitutionality, I would love to hear from somebody about maybe some of the conversations that took place around this.
Sure, I can take that one if you'd like, Chairwoman. But yeah, we certainly feel that this is within the authority of the city of Akron. We are under a declared emergency, state of emergency. And as we just reiterated, that emergency is only getting more and more dire. We've exempted, certain protected activities like religious gatherings and things of that nature. And this is not unprecedented. We do regulate what goes on in people's private residences all the time. As James would mention, we regulate zoning and what you do with your property and in various ways. And we certainly think this is within our rights to do. And it's certainly justified by the conditions and the state of emergency. And it's necessary for the health, welfare, and safety of the citizens of Akron.
Are there any precedents or any other, cities, municipalities that we can look to that, have taken a measure like this?
Yes, Cleveland started in July, actually, had been enforcing it since July. Other cities are.
Is it just me? I'm losing what the mayor's saying.
I can chime in, I think, to where the mayor was going.
Within the state?
I believe Kent has one. Kent City has an ordinance as well.
And interestingly, historic little nugget, Councilman Freeman, City of Akron actually did this in 1918 when we had the flu pandemic.
Say that again, Mr. Hardy. We had that.
I'm only channeling Dave Lieberth. I'm not actually Dave Lieberth, but we actually did a similar ordinance in 1918 when we had the influenza pandemic.
Thank you.
Okay, next we had Councilman Kamer, Councilman Malik, and we also have President Summerville.
Thank you, Madam Chair and Sarah. Obviously, thanks, Donna, for your hard work and the hospital executives for joining us today and their work. I know Fusco and Neil both brought up concerns and good questions that I had. And I kind of agree with my colleague, Neil. We're really intrusion on private properties, owners, and that's my concern. And over the last couple of months, I think we could have done better out in the public. I mean, we're still having sporting events. We're still having folks go to the Cleveland Browns games. I see it all the time at stores, restaurants. I just think we could do more in the public before we go and start addressing this on a private property, homeowner or a tenant. I don't think we're really standing behind our Akron Police Department like we should be, and we're asking them to do more. That's a major concern for me too, is I really would like us council members to stand with them and do more for them. And then basically we're asking them to go into more people's homes potentially, and try to address this issue. If it was more just Summit County Health, I would understand. But obviously I know our Deputy Mayor of Public Safety is on here, Charlie Brown, and he can address any concerns or let me know if we have the resources to address this if we do get the calls from neighbors in our neighborhoods. But as of right now, I do have a concern in regards to this piece of legislation. And I just wanted to bring that up. Thanks for the opportunity to speak.
Madam Chair and the Councilperson Kamer, this is so important that we have to make those resources available. As I heard that the leaders of this health systems in our city, we understand how important it is. So we'll make our officers available to do that important work. And thank you for the consideration, Mr. Kamer. I appreciate that as well.
Is it Malik next?
Yes.
Thank you, Madam Chair. Thank you to the mayor and his team and Commissioner Skoda and our hospital. I have, heard from a number of residents today, and it obviously is a significant step to take this step, but it, I think, is commensurate with the seriousness of what we're dealing with. I think, to Mr. Hardy's point, what we're dealing with is when people let their guard down in their houses, it doesn't just affect the people in that room who make that choice. It affects the people they're sitting next to in a cubicle, the people they're working next to in a store, the people they're shopping next to at Acme or Giant Eagle. And that simply is overwhelming our hospitals. That's leading to the death that we're facing. And we're hearing from all the experts that that's the case. And I don't want to be in the position that we're in, but it's the position that we're in. And so I'm going to support this legislation. I do have a couple of questions. I appreciate the comments about the legality under the state constitution and our powers. I know that there are frequent discussions with the state government. Has the state government weighed in any of those discussions on whether they're considering anything like this, or on whether they're encouraging local governments to do things like this? And then the second question that I have is also about our public safety forces. I certainly understand that they're going to take a fact-finding role, but people are going to be angry. People are going to be fired up about this. And, I would hope that there's some kind of assurance that we're hopefully going to not, be involved in, people aren't going to be arrested for obstructing or for resisting or anything like that, that it's more like, hey, folks, can you do this? If not, Summit County Public Health is going to follow up. But anyways, those are my two questions.
Hopefully I'm not as unstable as I was before. Can you all hear me okay?
Yes.
Okay, good. Well, first of all, I think leadership is sometimes unpopular, and if you're going to take those positions, but this is about saving lives. So this was never going to be about using public safety to knock on doors and look in windows, but purely in a support role. So there's certainly resources to do that. And we had those discussions like last week and made those decisions already. And second, in conversations with state government, I think from the very beginning, when the governor ordered a shutdown, which I think was significant, but it was the one thing that flattened the curve to almost nothing. Now, what we are trying to do is to not have another shutdown. We continue to have discussions about where this spread comes from. And quite frankly, it has not come from schools significantly. It has not come from restaurants significantly, because they have done the things to try and do that. And so if we're going to have that discussion about saying, how do we get businesses to make sure that they can stay open? How can we get schools back in so kids can go to the classroom in a safe way? All of those things, this is a precursor to that. So we don't have another shutdown. So if the question is that, are we asking permission from the state government? No, because number one, I don't think we need it. Number two, I don't think that they've had the response to say, listen, we're going to shut down again. I don't think you'll ever see that again, unless these hospital systems say, listen, we can't treat another person. And I think this is a precursor so we don't get there, because we don't want to see another economic shutdown. So where these businesses have to close, and then everybody's got a dispute of whether you're essential or not. This is a precursor to that, so we don't have to do that. And so I think I rightfully understand the constitutionality of it, but the authority is there to be able to do it. And we've done it before. And I know I've been cut off, but there are states and cities across the country, and Cleveland has actually been doing this since July under their charter. Whether they've been real successful at it or not, I think they, as a bigger county, they probably have outdone their peers in doing that. So those are the answers to those three, and then the follow-up to the one.
Thank you very much, Mayor. And Ms. Nish, I'm going to follow up after the meeting with a question about some of the exceptions. Thank you, everyone.
I just want to make sure that I heard this earlier from Ms. Nitch, that there's a lot of education that's going to happen if you show up at my door for the first time. And I think that is the main objective, is to educate folks and to make them aware of what they're doing and why there's a concern, and then what the next step could be. Am I correct in saying that, Donna, Ellen?
Yes, I think that's absolutely correct. I mean, the first goal of either the Akron Police Department or the Summit County Public Health Sanitarians is going to be to inform the property owners or the occupants of the fact that this ordinance is in place and what's required of them. Certainly voluntary compliance is going to be the goal. This is not intended to be a confrontational interaction between the police and citizens. It's going to be education based. And again, there's going to be compliance follow-up that happens later through Summit County Public Health. So absolutely education is the goal. And part of what we've been hearing from Donna and her team this entire pandemic is there's nothing they can do about large house parties. So some people have been completely flouting advisements from public health this entire time and hosting large gatherings of 50 or more people. And there's never been a law in place that they could use to even threaten compliance or to hold these people accountable. So now there is something in place that, you know, again, for egregious offenders or repeat offenders where we have, you know, an order in place that we can really use that to compel compliance and get people to, you know, cease this really dangerous behavior that's impacting public health around the entire city.
Okay, I think next is President Summerville.
Thank you so much, Madam Chair. I just want to take an opportunity just to thank all of our CEOs for being on this call and our Health Commissioner and of course, Mayor Horgan for all of his work on this. And I think we've heard this several times, and I think that it's really important. You know, we talk about success of our classrooms, our businesses, restaurants, being able to still be open because they are abiding by regulations. And I think the same thing has to happen when we're talking about even in private residence. You know, regulations are needed because the reality of it is that most people just don't know how to gather in a safe way, right? We're with our family, we're comfortable, our guards are down. We just don't know how to do it safely. And I think regulations really just are needed. I think our times are really serious. The fact that we have all three of our CEOs from our hospitals on this call right now and our health commissioner, it's serious to hear that 90% of our ICUs are already full, to hear that there's possible staffing concerns, to hear that in the city of Akron, we're going to be choosing care. That's alarming. I'm alarmed when I hear that being a licensed funeral director, because we're not even hearing the burden that, you know, if we don't do anything, that's placed on funeral home firms and how we do business and how we do things successfully and in a safe way. So it's really, really, really concerning. And I think extreme times call for extreme measures. And really and truly, it's not that extreme. We're talking about 30 days. I think we have an intervention on the table that can help slow and stop the spread. And I think we have that responsibility to do that. I am in total support of this. I think it's a 30-day sacrifice, but I think if we don't make the sacrifice, if we don't do what's right, the city of Akron will have a big problem on their hands that council will then have to come back and figure out how we address those issues and how we can support our hospitals so that they can support residents and do their job in a safe way. So I think 30 days with the extreme measures that we have and the state of emergency that we're in, I think it's a sacrifice that is definitely needed to make sure that residents in the city of Akron are safe. So I'm in total support.
Thank you very much. I think, have we heard from everyone, Sarah?
We have. I don't see any new hands raised. Let me scroll through one last time and see. Oh, I see Councilman Neal has his hand raised.
Sure. Councilman Neal.
Thank you. Ms. Dish made a point. And I know because I made calls and I had residents make calls. The numbers we're talking about are concerning because there's families that are that size. But I know for a fact, because it's been advertised on Facebook, I've driven by in the summertime about the house parties. And that's easier to legislate because they have 50 people packed into a house. You see it when they post it on Facebook. And honestly, excuse me for my ignorance, I thought we had an ordinance where we could enforce something there. I would much rather see us start to break down those house parties and to where it's and and I respect everybody's thing, but this is the thing. And Mr. Hardy said it. The beautiful thing about this country is our freedom of choice. The challenge is when our freedoms start to infringe on one another. And this ordinance, no matter which way you cut it, is going to infringe on someone's freedom. Because there are people who can properly gather as a big family and wear masks and distance themselves. There's others that have no choice because they live in a home where there are two, possibly 3 generations. This is a difficult thing, but I would have much rather, because I know for a fact the house party things have been an issue. And that's easy for us to get our hands around. And I don't think we would have anyone questioning us in that regard. This right here, is challenging. That's all I can say. But for us to go from 0 to 100, and again, excuse me, because I thought we had something in place addressing house parties, addressing large gatherings within people's homes. You know, I don't think we have any families that are 20 or 30 people. We do have families that push 6 to 8. So, thank you, Madam Chair.
Respond really quickly to clarify how the ordinance works. You're muted, but I think you said yes. So I just wanted to make sure that everyone understood.
Yes, I did. I'm sorry. Yes, go ahead.
That this is not intended to, it does not operate differently with large families. So even if your household is 10 people, you can have that household of 10 people plus an additional 6 guests. So if you live in a multi-generational large home, this doesn't impact you differently. Again, we're just concerned about the outside people who are coming into your house, no matter how large your household is. So that's why we developed it the way we did. Instead of saying, say, a total limit of 10 people, we wanted to make sure that we were accommodating those large families and not treating them differently. So everyone can have 6 guests, no matter how large your personal household is, even if it's a fairly large family.
Thank you very much.
Madam Chair, I can see that Councilman Fusco has his hand raised.
Yes, Mr. Fusco, go ahead.
Thank you, Mr. Moby, and I'll be extremely brief. Excuse me, I went into this totally open-minded. Realize the fact that we're asking our residents to sacrifice their liberties within their homes. But for me, the compelling thing is that I'm hearing is decisions are going to have to be made by hospitals in terms of who gets treatment and who doesn't. And that's a game changer, to be honest with you. I'm in. We need to do something, but I'm going to ask President Summerville, one of the sponsors, and Mayor, we can do it one of 2 ways. We've got to go on a regional basis. I would like us to either amend this, or it's simply just go ahead and ask our staff to make sure that cities around us, the counties around us, that they all get a copy of this specific ordinance, and that, and perhaps comments or what have you from our hospitals, that this does in fact get out. I know there's going to be articles and there'll be coverage, but I think we really need to get this out. And that's, either amending this or just simply mailing it out. But we have to get this out. Thank you.
Okay, thank you very much. Is that the last hand raised, Sarah?
It was. Let me just take a look one last time and see if I'm missing anyone. Thanks for your patience. I do not see any other hands raised.
Okay. May I have a motion for passage with suspension of the rules?
I'm going to make that motion to suspend the rules.
Second.
Is there a second?
It sounded like Councilwoman Baylor seconded that motion.
Yes. Let's do roll call, Sarah, please.
Sure. Amobian,
Yes.
Freeman,
I do want to see this come before council as a whole, although I'm not sure I'm going to be able to support it this evening, so I'll vote yes.
Baylor,
Yes.
Neal,
Stay.
and Lombardo.
Yes.
The motion passes 4-1.
Okay. Thank you very much. And this will go before the full council tonight. I don't think there's anything else coming before this committee. Am I correct, Sarah?
Appreciate your time. Thank you.
That is
Thanks,
correct.
Grace. Thanks, Brian. Thanks,
Thank you.
We are adjourned. Thank you very much. Bye.
Thank you, everyone. Our next committee for the day is the Rules Committee meeting, and those committee members are Freeman, Fusco, Amobian, Connor, and Malik. And all members are present whenever you're ready to get started, Mr. Chair.
Okay, let's go ahead. Given the time, let's go ahead and proceed here. If we could have a roll call, please, Sarah.
Yes, Freeman,
Aye.
Fusco,
Aye, present.
Amobian,
Aye.
Connor,
Aye.
and Malik.
Aye.
All members are present.
Very good. Do we have a motion to accept the minutes from the last meeting?
So moved.
Second.
We have a motion to second. All in favor? Aye.
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 Opposed? Okay, very good. We have two items in rules today. The first is a resolution acknowledging the life and judicial and public service legacy of Judge James R. Williams, expressing condolences and sympathy to the family, friends, and colleagues of Judge Williams on his recent passing and declaring an emergency. And I believe that we had the mayor, several other council people on this. Would anyone like to speak?
I certainly would.
Okay, please, Ms. Amobian.
This is Councilwoman Amobian. I've known the Williams family for years now, and certainly have known Judge Williams, and just a remarkable man with an outstanding record of public service and assisting all of those of us who are in public service in many ways. I know he's been very ill, but he is truly going to be sorely missed from this community. The first and only African-American, I believe, to be elected countywide in this area. Again, an outstanding leader, outstanding public servant, one who served on council and went on to become a judge, and has just served this community on so many committees and in so many ways. And the only reason we didn't have a proclamation for him last week was because I thought the service was private and just family only. But I think this resolution speaks volumes as well, because it will go into the history books and certainly recognizing him for all he has done for this community. Thank you very much.
Thank you, Ms. Amobian. I'm looking around. Sarah, do we have any other hands?
Yes, I can see that the mayor has his hand raised, and also Councilman Fusco and Councilman Malik.
Thank you. Mayor, please.
Obviously, Judge's impact to everybody, was significant. And I'm sure this is not his first resolution too. I know he's been honored before. I mean, like I said, a longstanding family, just with very strong public service ties and what's doing right for the community too. So obviously we're supported. I think he lived a wonderful life, as a wonderful example for a lot of us in public service and really how to conduct yourself. So I appreciate you, all of you, bringing this forward and support it wholeheartedly. So thanks.
Thank you. Mr. Fusco?
Yes, thank you, Mr. Freeman. Yeah, just that I didn't serve with in any capacity with Judge Williams. However, though, had a lot of discussion. And I can tell you he's one that for those of you who didn't have that opportunity, just conducted himself with class and dignity, and truly did. Akron, absolutely, without question, I think we can all say is a much, much better place because of his service. And I just ask that we pass this evening. Thank you.
Very good. Mr. Malik.
Looks like we lost him. He might be trying to rejoin.
Okay. Was there anyone else that wanted to speak? I was just hoping maybe we could have one of the sponsors would suggest that this would be mayor and council as a whole. Okay.
Yes, mayor and council as a whole.
Okay, is there a second on that?
Second, if we can do it in committee. I thought we had to wait till tonight.
Yeah, we would have to do that at the evening
Okay, very
meeting
good.
for all of council to vote on it. I can see that Councilman Malik has joined.
Okay, Councilman Malik.
I'm sorry about that. My Zoom just kicked me
Sorry.
off. Never has happened before. But yeah, just want to echo the comments made by Councilwoman Amobian and by the mayor. I mean, Judge Williams' legacy speaks volumes. Being one of the first Black graduates of the University of Akron Law School, and being, a United States attorney appointed by the President of the United States, just so many things, and co-founder of Alpha Phi Alpha Homes, just in so many arenas and areas. So, just condolences and thoughts and prayers go to the family and all those who were affected by Judge Williams.
Thank you. Yeah, interestingly enough, my first encounters and work with Judge Williams was not through any political connection, but rather he was a volunteer and a faithful board member with the Salvation Army for years, and so I know of his service kind of in another arena. But all right, if we could just have suspension of the rules, we'll bring this before council tonight.
So moved.
Suspend the rules. Favorable report.
Okay, we have a motion and we had a second. All in favor, let me know by saying aye.
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 Okay, very good. Our next resolution is a resolution expressing gratitude of the city of Akron for the diligent and successful efforts of the bipartisan teams of election officials and poll workers to ensure a safe, secure, accessible, accurate 2020 general election in which every registered voter was given the opportunity to contribute to our democracy, and declaring an emergency. And Mayor, if you're still on with us, would you like to address us?
I would. I thank you. This is especially in and around the rhetoric. I think what comes from others at some particular point about maybe looking at the elections process and maybe giving it less of value. What you saw here, I think, in Summit County and across the state of Ohio and across the country was a significant number of very dedicated public servants who are our friends and neighbors, who work with us, who we interact with all the time, who sometimes volunteer to do these jobs, really record and count and tabulate and will eventually certify a record number of ballots, in and across the state of Ohio and Summit County and the country. And quite frankly, they don't get enough of a recognition. And I thought it was important to at least tip our hat to them at some particular point and say, listen, nice work. We understand the pressure. It was not easy, especially during a COVID, especially during a very heightened political awareness about what's going on. But they really did an excellent job of keeping us safe, recording our votes, and just doing the job that they were supposed to do. And I think that's underappreciated. And I thought we should at least tip our hat and honor them in some particular way. And I think that's important.
Very good. Thank you very much, Mayor. Yeah, an amazing day, election day in America. And it comes off, for the most part, it comes off without, I don't want to say without fanfare, but without riot, without turbulence, and just a testimony to the strength of our democracy. So thank you for this. Any other comments from council members, committee members?
The only thing, this is Omobian. I don't know.
Yes.
This one speak first, Mr. Chair.
Please.
Okay, this is Linda Omobian. The only thing I like to say is that not only did we have a large number on election day, I think people started voting extremely early because of this terrible pandemic and all of the other suggested obstructions that were occurring to the vote. And I just like to commend all the voters for coming out in such strong numbers, and those who worked, certainly the polling places, because they not only worked the election day, as I said, they worked whole month and a half prior to that or more. So it was fantastic that it went so smoothly.
Thank you very much. Sarah, am I missing any hands?
I don't see any others.
Okay, very good. Okay, so I would ask if we could have a motion from someone, please.
Suspend the rules, favorable report.
Okay, you have a motion and a second. All in favor? Aye.
Aye.
Opposed? Okay, very good. And that will then wrap up this for our rules meeting, and we will adjourn at 3:51. Thank you.
Okay, the next committee of the day is the Public Utilities and Green Committee. Those committee members are Swirsky, Freeman, Samples, and McKittrick. Looks like all members are present with the exception of Swirsky, and we are still waiting for some cameras to be turned back on.
Okay.
Okay, it looks like everyone is back. We are ready to go whenever you are, Mr. Freeman.
Okay, very good. We'll call the Public Utilities and Green Committee meeting to order. If we could have a roll call, please.
Freeman.
Aye.
Connor.
Aye.
Samples. I saw you. There you are. And McKittrick.
Aye.
All members are present except for Swirsky.
Okay, very good. Do we have a motion to accept the minutes from the last meeting, please?
So moved.
Second.
All in favor? Aye.
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 All right, thank you. We have one item coming before us today. This is an ordinance authorizing the purchasing agent to enter into a contract or contracts without the formality of advertising for bids with United Systems and Software Incorporated for the purchase of encoder receiver transmitters for winter meter repairs by the Bureau of Water Supply and declaring an emergency. Mr. Ludell, please.
Thank you, Mr. Chairman, members of the committee. Yes, as you said, this is to purchase around 375 of these ERTs. They are mounted near our water meters. And then as our drive-by system goes by, it transmits the signal. So, and then that data is sent back every evening, and that's how we bill for our water meters. We've been talking about a new water meter project that is coming in the spring, but we do see a failure of these ERTs, especially as colder weather sits in. So this is just basically to get us through the winter till we get our new program rolled out.
Okay, very good. One question. I know, we're looking at a new program. We're buying these, which is on, the tail end of our old program. What we're buying, is there any marketability for them, once we've gone into a new program?
I don't believe there are. I mean, we could look at other municipalities, but I don't believe there are as a market for them. No.
Okay, very good. Okay, any other questions or comments from committee members? Looking around here. Any other council members have a question or comment? Okay, I'm not seeing anything. Mr. Ludell, what would be your wishes?
Consent is fine, sir.
Okay, I need a motion for consent.
I'll make that motion.
Second.
A motion and a second. All in favor, please let it be known by saying aye.
Aye.
Opposed? Okay, thank you, Mr. Ludell, and we'll see that that's placed on the consent agenda.
Thank you, sir.
Thank you. And we will call this meeting adjourned at 3:54 p.m. Thank you.
Our last committee meeting of the day is the Budget and Finance Committee meeting. Those committee members are Freeman, Amobian, Malik, Baylor, and Lombardo. It looks like all members are present, so we're ready whenever you are, Mr. Freeman.
Okay, if we could please call the Budget and Finance Committee meeting to order. Ask for a roll call, please.
Freeman.
Aye.
Amobian.
Aye.
Malik.
Aye.
Baylor.
Aye.
And Lombardo.
Aye.
All committee members are present.
Okay, very good. Need a motion to accept the minutes from the last meeting, please.
So move.
Second.
So I have a motion and a second. All in favor? Aye.
Aye.
Opposed? Okay, very good. Okay, we have one item on the old agenda. Do we have any discussion or motions on that agenda, on that item? All right. Okay, very good. Then we'll go into our new agenda. Let me scroll down here. And we have one item on our new agenda, and that is an ordinance providing for the temporary appropriation for the current expenses and other expenditures of the city of Akron for the period of January 1st, 2021 through March 31st, 2021, and declaring an emergency. And who do we have with us? Ms. Donnell, are you going to be speaking to us?
I think Shelley is going to open up.
Thank you, Mr. Chairman and members.
Okay. Hi, Shelley. Sorry about
Hi,
that.
how are you? No worries.
Very good. Please proceed.
Thank you, Mr. Chairman and members of committee and council. Please find before you a temporary appropriation ordinance allowing the city to continue operations from January 1st, 2021 through March 31st, 2021. Because we have some newer council members, I wanted to go ahead and just give a little bit of detail about why we do a temporary appropriation ordinance and the legalities as to why it must be passed by November 30th. The ordinance that is before you, we bring to council every year in November, as the city of Akron has traditionally not conducted budget hearings and passed a final budget until the first quarter of the budget year. This is allow the finance department to have an accurate picture of all the expenditures and revenues of the prior year, and to give council the most accurate revenue and expenditure projections for the upcoming year. We like to have as much data as we can before we go into budget hearings. So we traditionally have always held those during the first quarter of the budget year. This is especially necessary in a year such as this, where the unprecedented nature of the pandemic, another looming shutdown, an increase of COVID cases has really made it difficult to predict our year-end revenues and expenditures. For example, there's also a bill pending in the state. We are getting income tax withholding for individuals who are working from home, but were previously reporting to work in the city of Akron. The pending bill, Senate Bill 352, would end that requirement to remit the workplace withholding. The passage of that bill would be catastrophic. The city of Akron's closely monitoring that. However, we need to wait and see what Columbus is doing over the next month and to see if this bill gains any traction in the legislature before we can adequately project withholding tax revenues for next year. So the ability to pass our annual appropriation measure in the first quarter is actually provided in Ohio Revised Code section 5705.38. It states that if a subdivision desires to postpone the passage of the annual appropriation measure, they can do so. It may pass a temporary appropriation measure, which is what we're asking for you to do today, and that they must pass an annual appropriation measure no later than the first day of April. So that's typically what we do. We need to pass this temporary budget by November 30th because our charter also states that no ordinance or resolution shall go into effect until 30 days after it shall have been passed by the council, except as hereinafter provided. And we need this ordinance to be in effect on January 1st, so we need this to be passed and by you all by November 30th. It's extremely common for most large cities in Ohio to pass a temporary appropriation ordinance and then to come back after year-end revenues and expenses are finalized to present a more accurate and finalized budget to City Council. This practice is utilized not only in Akron, but in Toledo, Cleveland, Youngstown, and Canton, as well as other various cities. City Council's role is to really be responsible for enacting laws and appropriating the funds. But what does appropriating the funds mean? It is the action taken by the legislature to authorize the expenditure of a designated amount of public funds for a specific purpose. The city needs the ability to pay salaries and expenditures in order to keep the city running until the passage of the final budget. However, do keep in mind that even after passage of this temporary budget, all expenditures of $15,000, this is the new charter provision, or more than $50,000 any expenditures more than 15,000 will still go to Board of Control for review, and expenditures over 50,000 will still come before council even when the temporary budget is in place. If you guys have any further questions about this piece, I just wanted to give you a little bit of background about why we normally do this and bring a temporary appropriation ordinance and then a final one in the first quarter. You know, myself, Cindy Donnell, and Mike Wheeler are all on here to answer questions that you guys may have on this piece.
Very good.
The numbers are pretty consistent with prior years. Some funds show a little increase, other funds show a little decrease. We base it on the first 3 months of actual expenditures in 2020 to build our 2021 budget. The one item I will point out for you, for returning council members, you may remember the appropriation ordinance, we budgeted wages and benefits. We would budget benefits, wages and benefits. We would budget other, and then we would budget capital outlay separately. In preparing to go to our new Workday software next year, the budget ordinance has been revised. So the capital outlay has been included with other and is now shown as discretionary. And that will aid in implementing our Workday software and the capital asset module. And I could go on and on about all the details of that. But I'll open it up.
Riveting.
Yeah, and customarily when appropriations come in, we always ask for, you know, a week's time. And I'm not making a motion right now, but I'm just saying customarily that's what we do. Gives us a chance to look at the numbers. And then for new council members or any other council members, as far as that goes, should we direct the questions to Ms. Donnell or to you, Ms. Goodrich?
If you could copy both of us, you know,
Okay.
I'd love to see what people are asking and Cindy's response. But really, Cindy and Mike did a lot of work on preparing this, and they know the numbers inside and out.
Okay, so for newer council members, you have any questions at all? This is the brain trust here when it comes to appropriations, and would encourage you to reach out to them because we will want to ask for passage on this next week. So I'm looking around. Questions or comments from any committee members?
I can see that Councilman Malik has his hand raised.
Yes, Councilman Malik.
Thank you, Mr. Chair, and thank you to our wonderful finance department folks. I guess just Ms. Donnell, I think, touched on this a little bit, but so is this more or less the same spending levels as the current budget for this year? And to the extent that it's not, can we sort of get an explanation of where those differences, what's the reason for those differences?
Okay, so it's based on the first 3 months of 2020 actual expenditures. So it's in line with how we actually spent funds January through March of 2020. Comparing that to our temporary ordinance for our 2021 temporary compared to 2020, there are some funds spent more, some funds spent less. General fund did show an increase. Now the increase in general fund was just over 2 million. The bulk of that was made up between the police and fire departments themselves. We had other data funds that actually showed decreases. One was our income tax capital improvement fund. And keep in mind, some of it's just based on timing. It depends what projects they're working on. If the expenditures occur January through March, they would get picked up one year, where the next year, if some of the projects are delayed, waiting on better weather, the expenditures might not hit our books until after March. Sewer did show an increase, as well as our medical self-insurance fund. And there again, it's a timing of some of those payments. But overall, it was only like a $5 million increase, which is just under 4%.
Thank you very much.
All right. Comments or questions, Sarah? Am I missing anyone?
Do not see any other hands raised.
Okay. Again, any questions or comments either to Ms. Donnell or Ms. Goodrich, that would be appreciated. So we could come in with an intelligent vote next week. So
Motion for consent.
Okay, we have a motion for consent. Is there a second?
Second.
Okay, we have a motion, a second for consent. All those in favor, please let me know by saying aye.
Aye.
Any oppositions, say nay. All right, very good. We will see that that's placed on the consent agenda. Ladies, thank you so much. I know these are difficult times to work in, trying to figure out the numbers right now, but thank you very much. You stellar work. So if there's nothing else to come before us, we will adjourn at 4:05. Thank you.
This is the final committee meeting for today. Thank you.